In this video, we're going to explore the severity of depression and how to differentiate between moderate and severe depression. Recognizing the severity of depression is essential because it helps clinicians determine the right course of treatment and ensures that individuals receive the appropriate care. While both moderate and severe depression are serious, understanding the distinctions between them can be vital in providing the best support. Let's begin by discussing moderate depression. Moderate depression is characterized by significant emotional distress that impacts a person's life. But individuals with moderate depression may still be able to manage their daily responsibilities, even if it's difficult. This means they might still go to work or school, maintain some relationships, and perform basic tasks. But they often struggle to feel engaged or motivated. Symptoms of moderate depression can include sadness or hopelessness that persists most of the day, loss of interest in activities that were once enjoyable but still manageable to a degree, fatigue or low energy, making it harder to perform tasks, though not to the extent of severe depression, sleep disturbances such as insomnia or oversleeping, but still able to function with effort, difficulty concentrating, but they are still able to make decisions and perform some daily functions. People with moderate depression may still experience feelings of worthlessness and guilt, but it won't completely incapacitate them. They may be able to reach out for support, and treatments such as therapy and medication can help them regain a sense of control and normalcy in their lives. Reflection questions. What are some signs that might indicate moderate depression, but not yet severe depression? How might someone with moderate depression still be able to manage daily tasks, despite the emotional distress? Now let's explore severe depression. Severe depression is a much more debilitating condition. Unlike moderate depression, individuals with severe depression often find it difficult or impossible to function in daily life. This level of depression can make basic tasks, such as getting out of bed, taking a shower, or eating, feel like monumental challenges. The symptoms of severe depression are intense and can have a major impact on all aspects of life. Here are some key characteristics of severe depression. Intense feelings of sadness, hopelessness, or emptiness that dominate the individual's experience. A complete loss of interest in almost everything, including previously pleasurable activities. This is often accompanied by anhedonia, the inability to find joy in anything. Extreme fatigue or lack of energy to the point where even simple tasks, such as brushing teeth or getting dressed, feel overwhelming. Sleep disturbances. Some individuals may experience insomnia, while others may sleep excessively, yet still wake up feeling unrefreshed. Cognitive impairment, where individuals have trouble concentrating, making decisions, or even processing thoughts. Severe depression can significantly affect memory and focus. Suicidal thoughts or behaviors, which are a critical red flag that depression has reached a dangerous level. Individuals with severe depression may think about death frequently, and some may even attempt suicide or engage in self-harming behaviors. Severe depression can also manifest in physical symptoms such as chronic pain, headaches, digestive issues, and muscle aches. These physical symptoms are often directly related to the emotional and mental distress caused by depression. Reflection questions. How does severe depression impact a person's ability to function on a daily basis? What are the key signs that suggest someone might be experiencing severe depression, especially when compared to moderate depression? It's also important to note that severe depression may involve psychotic symptoms in some cases. This is called psychotic depression. People with psychotic depression may experience hallucinations, seeing or hearing things that aren't there, or delusions, holding false beliefs. For example, someone might believe they are worthless, or that something bad is going to happen to them, even if there's no evidence to support these beliefs. Psychotic depression is one of the most severe forms of depression and requires immediate intervention. Treatment often involves a combination of antidepressant medication and antipsychotic medication, along with therapy. Reflection questions. What are the key differences between severe depression and moderate depression in terms of physical and mental impairment? How would you recognize psychotic symptoms in someone with severe depression? And why is it so important to treat these symptoms immediately? Treatment for moderate versus severe depression. The treatment for moderate depression generally involves psychotherapy, like cognitive behavioral therapy or interpersonal therapy, and medication, such as SSRIs or SNRIs. People with moderate depression can usually function with the help of these treatments, and they often see improvements with relatively short-term intervention. However, treatment for severe depression is more intensive. People with severe depression may need a combination of medications and long-term therapy, often involving hospitalization or intensive outpatient programs if their condition is particularly severe. For individuals with psychotic depression, antipsychotic medications are also commonly prescribed. The key difference in treatment between moderate and severe depression is the level of support required. Severe depression often demands a more comprehensive approach to stabilize the individual and address the dangerous symptoms of the condition. Reflection questions. How does the treatment for moderate depression differ from severe depression? Why is it so important to address the severe symptoms of depression, like suicidal thoughts or psychosis, immediately? In summary, while both moderate and severe depression share some common symptoms, severe depression is characterized by much more profound functional impairment, more intense emotional distress, and may include psychotic symptoms or suicidal thoughts. Recognizing the severity of depression is crucial to providing the appropriate level of care, from outpatient therapy to hospitalization and medication. In our next video, we'll take a closer look at the risk factors for depression, exploring the biological, psychosocial, and socio-spiritual factors that make someone more vulnerable to depression. Let's keep it going, and I'll see you in the next one.